you a woman in medicine feeling overwhelmed and disconnected from the personal fulfillment that you desire? You're in the right place. Join doctors Joanne and Erin as they rewrite the rules for women in medicine. Let's begin.
What if I told you that a sticky note could save someone's career? Yes, you heard that correctly, a sticky note. Or even a 2-minute phone call that could be the reason a colleague decides to stay in medicine. I know that we talk so much in this podcast about burnout and what's going on in the system and overwhelm, stress. But today we're actually flipping the script. And I'm here with my super co host, Dr. Erin Hurley. And we're going to talk about how sometimes this intentional, tiny acts of service I'm sorry, I'm going to repeat that. And we're going to be talking about how sometimes this intentional, tiny acts of kindness can make a huge difference in someone's life. And Erin is doing this super special event, and we were talking about how we needed to talk about this out loud. And let's go ahead and tell us about those notes from the heart. What is it? How did you come about doing all of that?
Well, Notes from the Heart started last year. Actually, Joanne, you and I interviewed a couple of individuals. One is Kim Downey. She's been a guest on our podcast 3 times, and she is a super connector. And when she invited me to speak on her podcast, Stand Up for Doctors, she paired me with Don Vasalka, who is one of the founders of Cards to Warriors. And that organization had started about patients with complex medical diseases and illnesses receiving cards from somebody who had nominated them, or even they could nominate themselves. And last year, around this time, the organization was also now including the healthcare team. And so we interviewed Dawn in episodes 71 and 72, this time in around March of 2025, about this Cards to Warrior program. And it planted a seed. And I thought, well, I'm on the board of my medical society. I'm on a statewide organization called the Oregon Wellness Program, where we provide free confidential mental health for healthcare providers. And to add a note of seriousness, that organization was born out of 3 physician suicides in Eugene, Oregon, that happened in about an 18-month span of time several years ago. And the question, just like when we interviewed Totten on our last episode, about what can we do about it? And so what I wanted to do in honor of National Doctors Day, which is March 30th, was have an event. So as a board member of my medical society, we created an event, Notes from the Heart. And it was about, can some small act of kindness, like writing a note to someone on your healthcare team, make a difference? So we created some cards the art was by a local student. And then we had a card making station for kids and adults alike to create their own cards. And then we had community individuals who were patients nominate their physician or member of their healthcare team to be recognized. And it was such an incredible event. It was our first one. And it's still being talked about almost a year later by those healthcare providers who were acknowledged at this event, as well as people who attended. So we're doing it again. When I heard about that, I was talking with a friend of mine who nominated her physician, and she says, I recently went to my doctor's office and they're still talking about the event. And I wasn't sure if we were going to do it or not again this year. And I thought, okay, that's a sign. It's meant to happen. So we're doing the 2nd annual Notes from the Heart event in Salem, Oregon, where I live and where I'm part of the Marion Polk County Medical Society. So it's through that organization. We're doing a fundraiser. It's going to raise money for the Oregon Wellness Program, which, as I stated, is a statewide organization under a nonprofit that helps provide free mental health counseling for physicians, PAs, NPs, nurses, and dentists, and is just an incredible organization. And so it's really going to be a heartfelt event where we're again featuring a local student artist to create cards. And we will be featuring local healthcare providers and their teams that are nominated by their patients.
This is so important. And I remember when we had this conversation about a year ago, I had one of my retreats for women in medicine right after and felt inspired, and we wrote little notes and then we shuffled them and we each took a number of them that we were able to hand out from to people in our lives, and remember the joy that we felt writing it. So there's the benefit too in on the side of the intention to create that energy that we know that we're going to put out in the world. And I can only imagine the effect of the people on the other side. So this is a beautiful reminder, as we both have retreats coming up as well for women in medicine, that it's such an honor that you're doing an event, but then also the reminder that this is something that we can do at any time with any resources. It doesn't need to be fancy cards, but the intention and the knowing the importance of this. I am so grateful that you are all doing this, and the ripple effect that we had this amazing speakers in our podcast who are examples of the connections and the ripple effect that we can have with just this very powerful conversation. So this is a
I'm going to add
beautiful
another layer
reminder.
to that. I want to add another layer to that, Joanne, because another reason this event happened, as you mentioned, we both do retreats for women in medicine. And Sherry Reichert Ballou is an author, and she has a beautiful book about Say It Now, which is all about tell your loved ones now, not at their memorial service, not at their funeral. Tell them now how much they mean to you. And she has a love list about writing a list of things that you love about people. So I have incorporated that into my retreats, where the retreat attendees actually write on a little slip of paper to each other about how their interactions over the course of the retreat have impacted each other. And then we have a little ceremony at the end of the retreat where we read them to each other, and then they take their slips home. And so we've also interviewed Sherry on our podcast and episodes 84 and 85 about bringing kindness and joy to yourself and others, and about mental health and acts of kindness, which dovetails into this. And we're going to be bringing Sherry on to our podcast on a future episode about another book she's written. More to come on that. But this is where we just talked in our last episode with Dr. Todd Otten, number 172, about the power of not being a silo. So this is about not just bringing together healthcare providers and their teams. This event is a community event that brings healthcare providers and their teams and their patients in a room working on gratitude practices together. Role modeling. It's so simple. Show up. We've got cards made for you, or you can make a card. Get creative. There's so many powerful layers to this event. And it also brings humanity into this, where people maybe recognize a little bit about the struggles that their healthcare providers or their teams are going through. And last year's event, there's sometimes we can be rigid in medicine and everything has to be planned out and structured. And I've learned that sometimes some of the most beautiful things happen that are not planned. And it just so happened that at last year's event, one of my good friends from residency is a local pediatrician, and family members that she had helped take care of were at this event. And after the other clinicians had been acknowledged, this dad came up to me and he said, "Hey, I didn't know that Dr. Pearson, who we've interviewed on this show before, was going to be here. Can I please say something about the impact she had on me and my family?" Totally unscripted. The fact that they were both there at the same time was pure magic. And it was such a heartfelt moment. And I loved it even more because I know and care about both of these individuals. And to have that extra layer added on was so inspiring and reaffirming that sometimes we just have to say yes to opportunities, like Dr. Todd Otten said in our last episode about doing this documentary he's doing. So saying yes to opportunities that arise and just believing that it's going to work out.
Such important work. And bringing it back to burnout, and we discussed so many deep topics in this podcast about burnout and mental health and some of the struggles that so many of us go through, and how both of us, in terms of our professional medical work, and me as a psychiatrist, and what you've done as a pediatrician and abuse medicine, as well as what we do with coaching, we can see how this small acts, like a note, a coffee, a call, can make a big difference. But like you were saying, sometimes because we think big and like perfectionism and all the big things, and we sometimes minimize what we need. We minimize even accepting help, like we were talking before we started recording. And I wanted to hear from you, one, what else have you seen firsthand in beyond what we do at big scale, but how this acts of kindness that we can all do can create that big shift, not just in burnout, but then also even mental health?
Well, first of all, I'm going to give an example that just came to mind. And this is me as a retired pediatrician and also a coach who pays attention to what's going on in my universe and how can I make it better. And many physicians, I think, we talk about perfectionism, we talk about self-doubt. I'd like to share an occurrence that happened to me within the last couple of years on a plane. And in medicine, we're oftentimes perfectionists. We think everything through. We want to have it all planned out and make sure it's all going to work out okay. Many of us also worry about our reputation. What's it going to look like? What are people going to think? And I've learned to try to turn part of that off and make sure that I'm intentional about my actions and also not missing out on opportunities to make an impact. So I was sitting next to mom on a plane. She was traveling with her young child who was, I would say, under 15 months old. And the child was unconsolable. As a retired pediatrician, a mom of 3, a coach, I'm always looking for, okay, is there a service? What can I do to help with this situation? And I'm not stressed out with crying babies. I'm like, here, hand them over. I have some calming techniques. Let me intervene. Let me have the baby. And so I'm not freaked out. I'm not disturbed by crying babies. I'm asking myself, is there something I can do to help? And me and the mom might have had some chit chat. It wasn't much. I didn't know her well. And I just remember asking, is it okay if I put my hand on you? And Joanne and I talk about some woo-woo stuff on this podcast, and I'm getting more in alignment with my energy and the energy that's going on around me. And I basically I put my hand on this mom's arm. She was sitting on my right, and I just channeled calm and peace and presence through that mom into the baby, because I knew and that I could also absorb what was the stress this mom was feeling, what was the anxiety. And I learned to, I would call it like push and pull my energy when I was working in child abuse medicine for a decade, because families came in extremely stressed. And my goal was, how can I gift you some calm in this chaotic moment? How can I absorb from you what doesn't serve you and kind of push positive energy in, if you'll allow it, in order to create the most calm circumstances? Excuse me. And so in this moment on an airplane with this relative stranger, I chose to ask permission to make contact, and then also to try to influence the energy and give the mom the strength she needed to not get further anxious by what was going on with her child, to not worry about what are the other passengers thinking. And then after her child fell asleep and was quiet and calm, the mom and I were able to have a follow-up conversation. And it was something that I could do easily for this mom. She didn't have to ask. I was able to offer, and I wasn't worried, what's she going to think of this woman sitting next to me that wants to help? And yet shared with me that that moment helped her get through a stressful time. And I know what it's like to travel with infant twins on my own without my husband there. It's stressful, right? And so sometimes those tiny little gifts, even if it's to a stranger, can we be less worried about what is it going to look like? What if they say no? If she would have said no, I would have said no problem and respected that. But when we can offer and when we can also be saying yes to receiving those offers of help, because sometimes as physicians, we can be, or healthcare providers or women in medicine, we can be so resistant. Someone offers, hey, I'm going to go get some coffee. Can I get one for you? It's not only a gift to yourself, it's a gift to the person that's offering. Because that moment where I was offering support to this woman, I still carry it with me. And it was precious and such a gift to me to be able to have that moment of connection with her. So, how can we not only give when we have capacity and also receive when we're depleted?
Yes, I was going to say it's easy for us to give and remember how good it feels. And it's a good reflection to think of that sometimes when we're on the other side and someone offers and we say that word that we repeat all the time, like, no, I don't need help, I'm fine. To remember, we're also depriving someone else from the feeling they're gonna get for helping us as well. And of course, then I love what you were saying of bringing the energy, like knowing what does this person feel. And I don't know if it helps, right? Like we talk about woo woo, but whenever I'm in situations like that and I see someone struggling, or even if I react, we're human, we're going to be like, oh no, I'm next to a crying baby on a plane. And having sympathy and compassion for ourselves and the other person, and then saying, you know what, I can just send them calm energy, and I hope that the mom is okay, I hope that we all arrive safely. And whether it creates a change in the environment, which we actually know it does, but for sure it helps me. So it there's those details that we cannot minimize and be like, oh, whatever, that doesn't help. Like,
And there is research, I think we've shared it
exactly.
before, where it was sharing that, I think it was from Vanessa Edwards, who's all about body language and the messages we send through different kinds of communication. And I may not have it exactly right, but I believe that it was something like within, is it like a 25-foot radius of where you're at, you will have a 30% negative impact on those around you if you're a poor performer. If you're a high performer and sending out positive energy, you will have, I think it was it like a 15%? Don't quote me. I'd sit and look it up. But you have a positive or negative effect depending on what energy you're bringing in the radius around you. And actually, there's other research, I think, in the Happiness Advantage. What is his? Sean Achor wrote a book. I think it's called The Happiness Advantage, something about happiness. And I believe that your mood will affect people within a 1-mile radius of you. And
Mhm.
I don't remember the details. It's been too long since I've listened to that book. We do have an impact. And again, whether you are telling those people or not, you can just exude your own positive energy bubble to those people around you, or we can also bring the negative, and that's for another time. So the other thing, the ripple effect. So from this one event, that because I was inspired by Sherry and inspired by Dawn, because what they had shared and what we had learned from them, was inspired to create this event. And I love creating events, so pretty easy. And I could have been worried, what if it's a flop? What if no one comes? What if? Or I could just say, what if 2 people come and this was exactly what those people needed? And not only did I get reaffirming a couple months ago from one of my friends who nominated her physician that it was still making an impact. The medical director of the nonprofit that sits above this organ wellness program attended. And at a recent meeting, she shared how meaningful it was to attend the event. And she drove like an hour to be here and is planning to come again this year. So I got some external affirmation that this is the right thing to do it again, and to believe it's all going to fall into place, even though I've got lots of stuff going on, and just believe whoever's supposed to be there will be there, and not worry about what if it's not big enough? What if people can't come? And it all came together. Friends, child created the artwork for the cards. And then people that I knew were ready to nominate their providers, and then the providers are saying, yes, I can come. And I just trusted it's the right thing to do, and everything's coming together. And I want to say easy, but I'm not overcomplicating it, and I'm letting it be as big as it needs to be and connect with as many people as it's meant to. And I think I've created an annual thing for my medical society to bring the healthcare providers and the community together in the same space and see each other's humanity, shared humanity, and build even deeper connections.
So good. And what I'm hearing you say, it's the reminder of the why behind what we do, because it makes sense to have times when we're discouraged or we don't want to do it, or we question why spend the time and the energy, and then the reminder of like, no, this is important, this creates a ripple effect. And then having that inspiration and motivation be the emotion leading the steps forward. And with that, I want to ask also, beyond this good feeling and inspiration, how can we start taking action right now?
The action can be as simple as letting someone know you're thinking of them, whatever your mode of communication is. It could be a one-line text. Hey, I'm thinking of you. There's a couple people I know with some medical stuff going on in their lives, and my text starts out with, no need to respond. I just wanted to let you know I'm thinking of you. No need to respond. I'm sending you love and good energy. We'll connect when you have capacity. So it's not adding any expectation. A voice memo, I used to not really care for voice memos because I was so busy. It was hard for me to pause and listen to them, and I couldn't just do a quick scan of the text. And yet there's another layer of connection when we use our voice versus the written text. Our brains are meant to process written and visual, so you can even send a video text if you wanted. But adding some extra color and ease to that. So sending a video voice memo or a video memo, writing a simple card, putting, as Joanne started out this episode, writing a sticky note. This morning when I was getting ready to record, I looked at my computer. My husband was helping me replace my dead plant in the background with some live ones. And he wrote me a little sticky note for those of you on video. And it says, I love you. You're awesome. And that was just this morning for my husband. It takes 10 seconds. I've coached another client on interacting with a staff member to build communication and connection, and encourage her, just write a sticky note and leave it on there. If you don't physically run into each other, put a sticky note on their desktop or their laptop and let them know, I'm thinking of you. Let me know if you need something. Don't overcomplicate it.
One of my favorite things, I used to do this with the secretary. I love her, where I used to work, and I do it for other people, is, most people have like sticky note pads in their desk, and I'll just flip through it for you and kind of halfway just write like maybe not halfway, like after a few, to guarantee that they're going to see it, just write a note. So then it's like an extra surprise. They might be in the middle of the day and about to write a note, and there's my note. And I do that too when I go visit friends. I'll write a note and just leave it hidden in like a drawer that I know that they're going to open maybe a day or two after I leave. And again, it's just like, it's sweet, but we can go on and on giving examples of things like that. And we encourage you to think of your example, something that feels natural and might be a little stretch for you, but then knowing this makes a difference. Like, I know one of my good friends, she now, because I stay at her place a lot, like now she's expecting it, but from her heart, of like, I wonder where Joanne hit the note this time, right? Like in a cute, playful way. And we've talked about that also, of kind of bringing joy and fun back into your life. So this is also then.
And I'm going to put I want to put my coaching hat on, and I want to challenge our listener or our viewer on YouTube. And on YouTube, you can leave us comments. And I'm going to challenge. This is what we do in coaching. We're paid to push, and we challenge our clients. And so I'm going to challenge our audience to put in the comments of this YouTube, and there'll be a link to it in the show. I'm going to challenge each of you to do an act of kindness, big or small, and then put it in the comments. And that's actually going to give other people ideas and go, oh, well, this is too complicated, but I can do that. So I'm going to encourage you, if you're listening on one of the audio platforms, come on over to YouTube. And whether you listen to it there or not, give us a comment and we'll read every comment. And you're going to then create more of that ripple of change simply by role modeling how easy it is and share it with others in your office. Share what you did. Hey, I'm going to start leaving sticky notes. What's an act of kindness, or what are some other ideas you have? And do some social sharing. And then you can create your own ripple of kindness simply by something that you enjoy doing and that is easy for you. Don't overcomplicate it and see what happens.
And this is also perfect timing, knowing that National Doctors Day is March 30th. So you said also, as part of the challenge, to write a note for another physician that you know, or even if you don't send it right away, know that it'll create that ripple effect within you as well. And if it's like an actual physical note, how beautiful. But like Erin is saying, a phone call, a little note, a text. I know if you cross my mind, I am going to text you because I don't believe in coincidences. Or if and you might receive a weird text from me saying, you were in my dreams last night. Don't think it's freaky. It just happens. And I just wanted to say, hi, I love you. I literally texted someone who I haven't seen like in 10 years. And for real, she showed up in my dreams, and her whole family, even her parents. I said, I don't know what this is about, but I just want to say I miss you. And she texted me back like, oh, I've been thinking about you too. And again, just even that moment, it can shift our energy. And if you're in one of those days that I feel very stressed out and overwhelmed, this will help you as well. Erin, any final words of wisdom?
Well, if you happen to be in the greater Salem, Oregon area and you don't have plans on Tuesday, March 31st from 6 to 8 p.m., we are hosting an event and you can sign up. It's free of charge. We offer some light snacks and drinks. We will be we're doing a silent auction with gifts donated by Salem Public Market and raising money for the Oregon Wellness Program. And if you want to come join us, you can go to the Marion-Polk County Medical Society's event page, and we'll put the link in the notes, and you can sign up. And we have capacity for, I think, like 120 people. So I don't know how many people are going to show up, but if you'd like to be one of them, it's free of charge, and you can come on your own and come write some cards, design some cards, get your craftiness on. It's kid friendly. We make sure we have somebody that can help with kids so that you can bring young kids as well, and come join us, or maybe connect, and we can see how you can create your own little event in your own community.
Love that. I wish I lived closer. How many times do we say that? And remember, this acts of kindness, connection, role modeling, this ripple effect is so important. And this is how we get back to hope, and we keep on changing and moving forward. And with that, stay tuned because our next episode is coming right up.
Do you want exclusive resources and the opportunity to connect with us? Then visit createmeaninginmedicine.com now, where you'll dive deeper into how you can create meaning in medicine. And if you're serious about optimizing your results, take 2 quick steps now. Connect with us on the website and tune in to the next episode.